All right, so let's look at the arteries in the cardiovascular system. Many of the veins have some of the same names, and the list is a little bit shorter. So this is going to be a big chunk, but then the next section is going to be a lot smaller. All right, so yeah, this is a long list, but remember, some of these will be the same name for veins, and a lot of these are named similarly to nerves or to the bones that they're near, so that's going to be helpful. So if you've been doing your studying all through anatomy, it's going to pay off now, all right? So here we're going to look at the vessels of the head, the neck, and the arm. And there are, of course, way more vessels than we are including. So I promise you I made the list as short as I could, but these are just vitally important for you to learn. And again, if you will learn to draw out and diagram some of these and label those that you need to know, it really, really helps. So first we have the superficial temporal. Okay, so temporal tells you it's near the temple. Okay, or leading to the temple, and superficial tells you that it's near the skin. Okay, and so here you can see it really well, superficial temporal, and it's going to branch off. All right, so we're going to have the common carotid, and it is going to branch off into the internal carotid and the external carotid. You can also, from the inside skull view here, see on both sides here are the openings where the internal carotid feeds in. So this is the opening to the right and left. Remember, it's on both sides there, on both sides of the neck as well, bilateral. So here's that external carotid. So internal goes into the brain and where you saw it feeding in, but the external does not. So that does kind of make sense. So next we have the basilar artery here, basilar artery. It branches off from the vertebral artery. You can see it here inside from the superior view looking downward, and you can follow it here as well. You can follow the vertebral arteries on both sides, and then it branches up to the basilar section there. So the circle of Willis, and they use the term circle loosely, that's the circle of Willis there. This is an area where we have the joining together of several arteries at the bottom or the inferior side of the brain. Okay, the carotid arteries are going to branch into smaller arteries that are supplying oxygenated blood to over 80% of the cerebrum. So it's really pretty important. All right, next we have the vertebral arteries, which are going to supply vertebrae. Hence we get the name vertebral. You can see it here, and then we can trace it on up in here as it goes on in through the neck. Up through into the head. All right, so here's the common carotid. You have a right and left. Okay, so again, I want you to do this, right and left. So this is the left common carotid, and this would be the right one here. Okay, and remember, you'll have common carotid, and that branches to internal and external. So it's important to remember where are those delineations at. It starts as common. Anything that starts as common is almost always going to go off into other branches. Often that will be internal and external, but not always. And we've already seen some of that in the nervous system. All right, now we've got the subclavian. Sub means below. Clavian refers to clavicles. So if you think about where your clavicles are, this is basically below the clavicles. And again, you have a right and a left portion. All right, subclavian. Now we have axillary, and as I told you in the nervous system, when I think axillary, I always think armpit, axilla. All right, and so this is going to come from the carotid here, and then when you get near the armpit there, it's going to be called the axillary. So as it narrows down, remember it's location, location, location. All right, so now we call it the axillary, and you can see there is a split here. All right, and so when it reaches that split, this branch is the axillary. You can see the axillary in this arm model here as well. Next, we have the brachial artery. This is a major vessel in the upper arm. This is continued on from the axillary. So once it gets down here towards the brachia, it passes the lower margin of the teres major muscles. This is when it becomes the brachial. And then it's going to go on down to the ventral surface of the arm until it reaches near the elbow. The radial artery is the terminal branch or the end of the brachial artery. It starts at the cubital fossa of the forearm and goes along down the thumb side by the radius. The ulnar artery is, of course, associated with the ulna. It arises from the brachial artery as well, and so we're going to divide into the radial and the ulnar. So now we're going to look at vessels of the thorax, heart, and abdomen. This picture here, this is a really good one to learn to diagram. There's a video for that, and I actually like to draw this one out myself as well. It really helps you to draw them out and label them and do that 3 or 4 times, because then it's going to help you to learn it much easier, and you promise you spend less time if you do it that way. So remember, we have the thoracic area, so we're going to look at the vessels of the thorax. Here we have the brachiocephalic artery. So brachia referring to the brachial area, and cephalic referring to the head. And so first off, remember, there is no right or left. We have one brachiocephalic trunk, which feeds the brachiocephalic artery. And so no right and left on this vessel. This is the third branch here of the aorta, and it extends from that brachiocephalic trunk, which is going to be the bottom lowermost portion, and it supplies blood to the right arm, the head, and the neck. Alright, so here's one of those words again. It really does pay off to learn what these words mean. Intercostal, between the ribs. So we had intercostal nerves, we have intercostal arteries, and we have intercostal veins, alright, and intercostal muscles. So really good reason to learn what that word means. And so these are pretty self-evident, pretty obvious, I think, but all of these sticking out. So if it's red, it's going to be an artery, and if it's blue, it's going to be a vein. Alright, so now we're going to look at the coronary blood vessels, and these are blood vessels that actually supply the heart. So remember, the heart actually has to have blood too. It needs lots of oxygen. It's a muscle, and it's always working and beating. So we have the left circumflex artery, which supplies the left atrium and the left ventricle, and I'll leave some of that for the other slides. Alright, the right coronary artery. This is the blood vessel that comes off of the aortic arch. You can see that here. Comes off of the aortic arch and goes down the right side of the heart, and it supports, or it supplies, the right atrium and the right ventricles. Posterior interventricular. So posterior means lower, inter between ventricles. So this is a branch of the right coronary artery that is in between the ventricles there, supplying either side. Here we have the marginal artery, and it's the one in green. On these pictures, you really kind of have to look and see it's the green. We have a right and a left marginal artery, and it supplies the right one will supply the right ventricles and the apex, and the left one supports the left ventricles. Alright, so we have a left coronary artery. We already talked about the right, and so this supplies blood to the left side of the heart, ventricle, and the atrium. Blockage of coronary arteries are what causes angina. Alright, so next we have the circumflex artery, and it circumvents or goes around. Alright, and so you can think of the one that goes around. So this is the blood vessel that comes off the left coronary artery and goes around in the circumference, I guess you could say, of the heart. Alright, so here we have the anterior interventricular, so between ventricles on the front. We have blood vessels that come off the left coronary artery, and it goes down the interventricular septum. Alright, interventricular septum, you can see that in green here. You can tell it's going right down the middle, and it branches off to supply.